So let us begin now with neuroanatomy. All of you are waiting for neuroanatomy. Chalo, we'll start. Good evening to all of you. So neuroanatomy में a very important question. Superlateral surfaces of the brain, the sulci gyri, functional areas. Very important. यहाँ ये हमेशा पूछता है, but इसका ना content is very less. बहुत कम है लिखने को. Like superlateral surface of the brain आप draw करोगे, you'll draw the sulci gyri, and then you have to write. वो लिखोगे, then you'll get a substantial amount of answer. ठीक है? We'll start. Starting with superlateral surface of the brain. Okay. Now you tell me, ये क्या sulcus है? Central sulcus. Central sulcus is the sulcus of Rolando. Central sulcus is the sulcus of Rolando. Central sulcus separates the sensory area from the motor area. बराबर है? It separates the motor from the sensory area. So central sulcus is also known as, बोल सकते हो? Central sulcus is an example of what? Central sulcus is an example of. Any guesses? हाँ, टाइप्स ऑफ सल्कस पे एमसीक्यूज आता है. सेंट्रल सल्कस इज एन एग्जांपल ऑफ. एनीवन? इट सेपरेट्स द सेंसरी फ्रॉम द मोटर एरिया. तो इट इज एन एग्जांपल ऑफ डैश टाइप ऑफ सल्कस. अगर ये एमसीक्यू आता है, व्हाट आर यू गोइंग टू राइट? कम ऑन स्टूडेंट्स, आंसर. आई एम वेटिंग, आई एम लुकिंग एट द स्क्रीन. It's an example of a limiting sulcus. Limiting sulcus, ठीक है? So limiting sulcus क्या होता है? Which separates two areas, which limits two areas. Example is central sulcus. Fine. The second type of sulcus is an axial sulcus. Axial sulcus. Area नहीं, Richa. What are the types of sulcus? दूसरा होता है axial sulcus. Axial sulcus is the one which grows in the axis of a lobe. Example बोल सकते हो. What is this sulcus? Which grows in the axis of the occipital lobe. This is what we call as an axial sulcus. Axial sulcus. Hi, good. Okay, great. सबका पेपर अच्छा जाएगा. Don't worry. You all have been studying very well. It's all credit to you, all of you. My duty is to teach. Okay, credit to all of you. So central sulcus is an example of limiting sulcus. दूसरा type of sulcus है axial sulcus. Axial sulcus वो होता है which grows in the axis of a lobe. Example is calcarine sulcus. Calcarine sulcus. Any other type of sulcus? The third sulcus is known as operculated sulcus. Operculated sulcus मतलब that sulcus separates two areas and उसके अंदर एक area को enclose करता है. Like this is a sulcus here. So this is area 1, this is area number 2, and this is the third area which it encloses within the sulcus. Sulcus के अंदर है. Hi, paper हो गया, very good. So it encloses the third area within the sulcus. So such sulcus are known as operculated sulcus. Operculated sulcus. Fine. Good. Happy? Very good. Fine. So limiting sulcus, axial sulcus, operculated sulcus. ठीक है, ये याद रखना. So what is this? This is the central sulcus. Ravi, just wait, I'll tell you this later. What is this sulcus? That's a lateral sulcus. Come on, we'll finish this off fast. ये क्या है? Precentral sulcus. ये है postcentral sulcus. ये है frontal lobe. That's a superior and inferior frontal sulcus. That's a temporal lobe. Superior and inferior temporal sulcus. This is the parietal occipital lobe. So that's a parieto-occipital sulcus. This is the calcarine, and ये है lunate sulcus. Lunate sulcus. ठीक है? Get a distinction. We'll have a good interview with all of you. ठीक है? Okay, fine. So this is about the sulcus. Then gyrus के बारे में लिखना है. इतना आपको लिखना है. Then we start with functional areas. Functional areas दो types के होते हैं. One is a primary area and the second one is an association area. Fine. So now we start. Tell me, this is area number 312. What is 312? Answer. Be interactive. फटाफट खत्म करते हैं. What is this 312? 312 को हम बोलेंगे प्राइमरी सेंसरी एरिया. प्राइमरी सेंसरी एरिया, ऑल द सेंसेशंस व्हिच आर कमिंग टू द ब्रेन कम टू दिस 312. व्हाट इज एरिया नंबर 5 and 7? 5, 7 आर द सेंसरी एसोसिएशन एरिया. सेंसरी एसोसिएशन एरियाज. दिस इज द ऑक्सीपिटल लोब. यहाँ पे होते हैं विजुअल एरियाज. दिस इज एरिया नंबर 17. दैट्स अ प्राइमरी विजुअल एरिया. दिस इज एरिया नंबर 18 and 19. यह है विजुअल association areas. Visual association areas. Fine. This is area number 41, 42. What is this? This is the primary auditory area. This is area number 22. This is known as Wernicke's area. 44, 45 को हम बोलते हैं Broca's area. That's Broca's area. What is this connection between the Wernicke's and the Broca's area? Answer this. The connection between the Wernicke's and Broca's area is known as. चलो बोलो. Connection between the Wernicke's and the Broca's area is known as. Come on, students, you know this. You know this. Come on, be fast. Answer and get good marks. Answer well in the vivas. You know everything. सब कुछ कर लिया आपने अच्छे से. सब कुछ पढ़ाई कर ली है. Okay. The connection between the Wernicke's and the Broca's area is known as the uncinate fasciculus. इसका दूसरा नाम है arcuate fasciculus. Uncinate fasciculus और arcuate fasciculus. What is the type of fiber? What is the type of fiber? ये दो areas को connect करता है in the same lobe. This type of fibers are known as association fibers. Very good. Association fibers. So this is an example of association fiber. Very good. Now, this is area number 4. Area number 4 is primary motor area. This is 6 and 8. These are the premotor areas. 8 is also known as the frontal eye field. This is 9, 10, 11 and 12. अंदर की तरफ है. These are the prefrontal areas. Prefrontal areas. What is the function of prefrontal areas? Intelligence, memory, ego, self-respect, social behavior. Social behavior. Fine. So just remember this functional areas and the supralateral surface of the brain. जब blood supply का बात करते हैं, when we talk about the blood supply of the brain on the supralateral surface, बस ये diagram draw करना है आपको, which is the artery present in the lateral sulcus. Answer this. Artery present in the lateral sulcus. That's a very important MCQ. And ये है corpus callosum. That's the callosal sulcus. Corpus callosum के ऊपर है callosal sulcus. Artery in the callosal sulcus. Answer this. Very good, very good. Artery present in the lateral sulcus. That's a very, very, very important MCQ. चलो बच्चों बोलो. Artery present in the lateral sulcus and the artery present in the corpus callosum के ऊपर जो sulcus है, that's a callosal sulcus. So this is middle cerebral artery and this is the anterior cerebral artery, right? Anterior cerebral artery, यह है middle cerebral artery. The anterior cerebral artery supplies the entire medial surface. It goes to the supralateral surface. A small area here is supplied by whom? A small area here is supplied by anterior cerebral artery. This entire area is supplied by middle cerebral artery. यहाँ पे एक small area is supplied by middle cerebral artery and the occipital lobe and a part of temporal lobe is supplied by posterior cerebral artery. That's a posterior cerebral artery. बस ये याद रखना. Fine? Clear? Okay, fine. So that is posterior cerebral artery. So can anyone tell me what is the blood supply of the motor area? MCQ, if MCQ comes, blood supply of the motor area or the sensory area. I'm talking in English, sometimes some points in Hindi also. Fine. Shall I answer this? What is the blood supply of motor area or sensory area? Anyone? Come on. You know all this. Just put it together and answer. Blood supply of the motor area or the sensory area. MCA plus ACA. See here, that's the central sulcus, pre-central, post-central. This much part is supplied by what? Middle cerebral artery. ये कौन supply करता है? Anterior cerebral artery. This is supplied by anterior cerebral artery. So blood supply of the motor or sensory area is ACA plus MCA. Remember, that's a very important MCQ. These MCQs are asked in PG NEET also, right? Blood supply of the motor or sensory area. MCA plus ACA. Blood supply of the occipital lobe. Can anyone tell me? Blood supply of the occipital lobe is posterior cerebral plus middle cerebral artery, which supplies the macula. Macula is an area of fine vision. So normally what happens, क्या होता है, if blood supply of occipital lobe आता है, if blood supply of occipital lobe is asked, students write it as posterior cerebral artery, but it is supplied by two arteries. One is the posterior cerebral and the other one is the middle cerebral artery. The middle cerebral artery supplies the macula, which is an area of fine vision. Perfect. So just remember this much you have to write. Answer is that way, very small. You have to explain, you have to write theory, draw this slide and make it at least 2 pages for a decent answer. Okay, describe the supralateral surface of the brain under the following heads. Number 1, sulci gyri. Number 2, functional areas. Number 3 is the blood supply. So that's what you write. Fine. Okay, great. So this you know. Okay, now I'll just tell you this. That's an internal carotid artery. Internal carotid artery. What is this branch? That's an anterior cerebral artery. That's an internal carotid. This is the anterior cerebral artery. That's a middle cerebral artery. Fine. What is this artery? This is the anterior communicating artery. Anterior communicating artery. These are the two vertebrals. Two vertebrals will join to form the basilar artery, and the basilar will divide into what are these posterior cerebral arteries. What is this branch of internal carotid? What is this branch of internal carotid? That's a posterior communicating artery. You get a short note on circle of Willis. Circle of Willis pe you get a short note. So you need to write this. You need to draw this diagram. It is not circle. It is not that great circle. Fine. Okay, so this is internal carotid. That's a middle cerebral artery. That's an anterior cerebral artery. And this is the posterior communicating artery. Okay, so this becomes the circle of Willis. Fine. Just try to understand. So which of the following arteries does not take part in the formation of circle of Willis? If that's an MCQ, circle of Willis is formed by anterior communicating, anterior cerebral, internal carotid, posterior communicating, and posterior cerebral artery. The artery which does not take part in the formation of circle of Willis is, can anyone tell me this? Artery which does not take part in the formation of circle of Willis is, answer? Middle cerebral artery. Yes, very good. The artery which does not take part in the formation of circle of Willis is middle cerebral artery. You get a short note on circle of Willis. You just have to draw this diagram. You have to write how the circle of Willis is formed, and then you have to write where is the circle of Willis located. Where is the location of circle of Willis? It is not internal carotid. Option में आता है middle cerebral artery. Middle cerebral artery does not take part in the formation of circle of Willis. It is formed by anterior communicating, anterior cerebral, internal carotid is there, posterior communicating and posterior cerebral. The circle of Willis is not formed by middle cerebral artery. Fine. Now, what is the location of circle of Willis? Location of circle of Willis, just have a look at this. Fast you tell me. This is the optic nerve, optic chiasma. Ye hai optic tract. That's the optic tract. This are the crus cerebri, midbrain, pons, and medulla. Midbrain, pons, and medulla. Okay, fine. That's midbrain, pons, and medulla. Tell me, what is this view? Kahan se dekh rahe ho? Where are you looking this from? What is this view of the brain? Where are you looking this from? That's the inferior surface of the brain. And what is this area known as? This area is known as the interpeduncular fossa. Interpeduncular fossa. What are the boundaries of interpeduncular fossa? Anterolaterally is the optic tract. Posterolaterally is the crus cerebri. Crus cerebri. Fine. So anterolaterally is the optic tract. Posterolaterally is the crus cerebri. This area is known as the interpeduncular fossa. You get a short note on interpeduncular fossa. You get contents of interpeduncular fossa. So these are the boundaries. The floor of interpeduncular fossa is formed by, any guesses? The floor is formed by the pituitary stalk, the mammillary bodies, and the posterior perforated substance. The pituitary stalk, mammillary bodies, and the posterior perforated substance. The contents of interpeduncular fossa are, yes, tell me, what is this? What is this nerve? Which is this nerve? Suyesh, I'll talk to you later. Just wait. हम बाद में बात करते हैं. All colleges are good. Yes. Okay, tell me, what is this? What is this nerve that I've drawn? What is the content of interpeduncular fossa? एक तो circle of Willis है. One is circle of Willis, and the second is this nerve. What nerve is this? oculomotor nerve. Trochlear nerve नहीं है बच्चे, trochlear nerve नहीं है, it's oculomotor nerve. Trochlear nerve comes from backside, trochlear nerve पीछे से आती है. Trochlear nerve is not a content of interpedicular fossa. Content of interpedicular fossa is the third nerve, that's the third nerve, oculomotor nerve and the circle of Willis. Oculomotor nerve and the circle of Willis, fine. Trochlear, we don't call trochlear nerve as a content, Rohit, fine. Richa, trigeminal nerve is not a content of interpedicular fossa. Trigeminal nerve यहाँ है बच्चे, trigeminal nerve is here. It's at the junction of pons with the middle cerebellar peduncle. That's trigeminal nerve. ठीक है? Clear to all of you? Interpedicular fossa is clear to all of you? A very important topic. Just one moment. Look at this. That's the optic tract. Here is the crus cerebri. This is the interpedicular fossa. The floor is formed by the pituitary stalk, the mammillary bodies, and the posterior perforated substance. Contents, this is the circle of Willis, and then you've got the third nerve. Perfect. Okay, so that's about the, so just remember that much for the blood supply of the brain. Okay, now coming to the venous drainage of the brain. Venous drainage, just remember the way I'm telling you. We divide the veins of the brain into two set. One is the superficial vein and one is the deep vein. Superficial vein and deep vein. Superficial vein of the brain are of which type? One is the superior cerebral vein. Just remember this, superior cerebral vein. Second is inferior cerebral vein. Inferior cerebral. So superior cerebral drains the supralateral surface of the brain. The inferior cerebral drains the inferior surface of the brain. The superior cerebral drains into the superior sagittal sinus. The inferior cerebral drains into the cavernous sinus and the sigmoid sinus. Third is the anterior cerebral vein. Anterior cerebral vein. I'll show you this fast. Anterior cerebral vein. Pituitary stalk. Yes, pituitary stalk is a content of the interpedicular fossa. Yes. Pituitary stalk, yes. Okay, so we are discussing the venous drainage of the brain, students. This topic is slightly difficult. I'll try to make it as easy as possible. So superficial veins, deep veins. Superficial veins में the first one, okay, the first one is, these are the superior cerebral veins. They drain the lateral surface, opens in the superior sagittal sinus. Second is inferior cerebral veins. नीचे होंगे, they drain the inferior surface, opens into the cavernous and the sigmoid sinus. The third one is the anterior cerebral vein, which is present in the callosal sulcus. That's the anterior cerebral vein. And the fourth one is middle cerebral vein. Middle cerebral vein, that is of two types. One is the superficial middle cerebral and the other one is the deep middle cerebral. Fine, just remember this much. Can anyone tell me the superficial middle cerebral vein and the inferior cerebral vein, where have we heard this? कहाँ पे सुना है आपने? The superficial cerebral vein and the inferior cerebral vein. Superficial middle cerebral vein and the inferior cerebral vein were tributaries of something. ये किसके tributaries थे बच्चों? Whose tributaries were this? The superficial middle cerebral and the inferior cerebral vein were tributaries of what? Come on, try to correlate this now. You should be able to. We have already discussed this. Nahi, San, nahi. No. Cavernous sinus. Yes, cavernous sinus. These are the tributaries of cavernous sinus, bacho. You remember the tributaries of cavernous sinus, how we have grouped it? One is from the orbit, one is from the meninges, and one is from the brain. So from the brain, which are the veins which comes towards the cavernous sinus? Ek tha inferior cerebral vein, and the second one is the superficial middle cerebral vein. So these are tributaries of cavernous sinus. Perfect. So just remember this superficial vein, superficial, superior cerebral, inferior cerebral, anterior cerebral, and middle cerebral. Middle cerebral is made up of superficial middle cerebral and the deep middle cerebral vein. Fine. Okay. So now out of this, perfect. Are you able to follow this? Yes. Now this deep middle cerebral vein, I'll just write it here for you. Deep middle cerebral vein plus anterior cerebral vein plus striate vein joins to form a vein जिसका नाम है basal vein. Just remember this. This is the basal vein. So deep middle cerebral vein, anterior cerebral vein, deep middle cerebral vein, and the striate vein, which comes from the perforated substance, they join to form the basal vein, and this basal vein will drain into the great cerebral vein of Galen. Prarambh batch, September end, बच्चों, September end. You can start seeing the lecture of last year Prarambh batch. ठीक है? ये क्लियर है? So what is basal vein? Basal vein कैसे बनती है? क्लियर है? This comes in MCQ. So the basal vein is formed by the joining of deep middle cerebral vein, anterior cerebral vein, and the striate veins. Have a look at this. Look here. So ये है anterior cerebral vein. That's a deep middle cerebral vein, and this is a perforated substance. These are the striate veins. Now this joins to form the basal vein, and the basal vein drains into the great cerebral vein of Galen. बस इतना याद रखना है. This is what you need to know. Fine. Now coming to the deep veins. Deep vein. Now, deep vein is the internal cerebral vein. Superficial vein is clear. So deep vein एक ही है. That's a internal cerebral vein, and this is formed by joining of three veins. This is formed by joining of three veins. One is the septal vein. Second is thalamostriate, and choroidal. Okay, I'll just put numbers here, A, B, and C. So look here, this is septal vein A, this is choroidal vein C, and this is thalamostriate vein B. Okay, so the deep vein में एक ही है. This is the internal cerebral vein, and this internal cerebral vein is formed by joining of three veins. One is the septal vein, जो septum pellucidum से आती है. Second is the thalamostriate, and third is the choroidal vein. Three veins joins to form the internal cerebral vein. Now, two internal cerebral vein joins to form the great cerebral vein of Galen, and this great cerebral vein of Galen, this is the great cerebral vein. This drains into the straight sinus. Understanding, students? Look, I'll make a easy flow chart. I'll make a very easy flow chart for you. Just try to understand this. Look, how do I make this? Internal cerebral vein. Internal cerebral vein. This two joins to form. This is the great cerebral vein of Galen, and this great cerebral vein of Galen drains into what? What is it? Straight sinus. Take care. Now this internal cerebral vein in turn is formed by three veins. One is thalamostriate, second is choroidal, and the third one is septal. So three veins joins to form the internal cerebral vein. Two internal cerebral veins will join to form the great cerebral vein. Great cerebral vein drains into the straight sinus. Now what drains into the great cerebral vein is the basal vein. B-A-S-A-S-A-L. Basal vein. And this basal vein is formed by joining of three veins. Up clear hai? This is formed by joining of three veins. One is the anterior cerebral vein. Second is the deep middle cerebral vein, and the striate vein. That's it. That is the complete venous drainage of the brain. Understood? बस इतना याद रखना है आपको. Just remember, two internal cerebral vein joins to form the great cerebral vein of Galen. Great cerebral vein कहाँ पे drain करती है? Straight sinus में. How is the internal cerebral vein formed? By the joining of three veins. Thalamostriate, choroidal, and septal. This is formed at the interventricular foramen of Munro. And what drains into the great cerebral vein? The basal vein. The basal vein is formed by joining of three veins: anterior cerebral, deep middle cerebral, and striate veins. Bolo, clear hai? Is this fine, students? So this is in a nutshell how to remember the venous drainage of the brain. You get MCQs on this. You get blood supply of the brain as a LAQ. Blood supply of brain as an LAQ bhi aata hai. So you have to write about the arterial supply of the brain. You have to write about the venous drainage of the brain. You have to write about the circle of Willis. Fine, students. Any doubts here? Fine. Okay, great. Okay, now we start with the ventricles. Hi. So ventricles may third ventricle is very important. Third ventricle is very important. Fourth ventricle is very important. Third and fourth ventricle you should know. Lateral ventricle may come as a short note. May come as a short note. Okay. So I start with the third ventricle. This is the third ventricle. You have third ventricle. So just try to understand now how to draw this slide of the third ventricle. How do you draw this? I'll start. That's a corpus callosum. Corpus callosum. What is this? Chalo, I'll quickly go through this. This is a fornix. Fornix. Ye kya hai? This is the septum pellucidum. Septum pellucidum. What is this rounded thing? Anterior commissure. Anterior commissure. This is the lamina terminalis. Lamina terminalis. The optic chiasma. The pituitary stalk. The pituitary gland. The mammillary bodies. Mammillary bodies. Now we come to the midbrain, pons, medulla. Ye kaun hai? Pineal gland. And this, and what's this? Cerebellum. Cerebellum. Okay, now if this is the anterior commissure, exactly behind what is that? That's a posterior commissure. That's a pineal gland. What is this commissure? Any guesses? Come on, students. Hi, hello to all of you. This all you should know. ये practicals में भी पूछते हैं. Everything. See, if you do your theory well, now your practicals are always good. Because the same thing you'll be seeing in the section, sagittal section of brain. Neuroanatomy is a separate table of 10 marks, bacho. It has to be perfect, right? So what is this? This is the posterior commissure and this is the habenular commissure. Habenular commissure. Fine. So ye anterior commissure hai, piche posterior commissure. That's a habenular commissure. This is the pineal gland. This together is known as epithalamus. Epithalamus. Fine. Okay, have a look at this once again. So this is a corpus callosum. You have fornix, that's a septum pellucidum, anterior commissure, lamina terminalis, optic chiasma, pituitary stalk, mammillary bodies. That's a pineal gland, habenular commissure, posterior commissure. This is the midbrain, pons, medulla, cerebellum. Cerebellum. Fine. What is this now? This is the aqueduct of Sylvius, and this is the fourth ventricle. Fourth ventricle. And what's this and what's this? That's a superior and inferior colliculus. Superior and inferior colliculus. What is this view? Kahan se dekh rahe ho? That's a medial surface of the brain. That's a medial surface of the brain. We are not interested in this medial surface of the brain. We are just interested in this much. Okay, I'll start. What is this entire area known as? This entire area is known as the diencephalon. Diencephalon. So this entire area ko hum bolenge diencephalon, and this diencephalon is divided by a sulcus. Okay, what is this sulcus known as? The hypothalamic sulcus. The hypothalamic sulcus divides this diencephalon into what's this? Thalamus, and what's this? Hypothalamus. Hypothalamus. Fine. Corpora quadrigemina. Yes. Now this entire thing is the third ventricle. Ye jo dekh rahe ho na aap, that is the third ventricle. Now see, just try to understand. If this is the thalamus and hypothalamus of one side, thalamus and hypothalamus of one side, and this is the hypothalamic sulcus, this is the thalamus and hypothalamus of the opposite side. That's a sulcus. Now when you join these two, they don't stick to each other. They don't stick. The thalamus and hypothalamus are concave. There's a concavity here. This is the thalamus, that's a hypothalamus. This is the sulcus. For this side, that's a thalamus and hypothalamus. It's concave. And now when we join these two hemispheres, we get a cavity here. And this is the cavity of third ventricle. Matlab, this entire area that you're looking at is the third ventricle. Now, if these are the two hemispheres, ye do hemispheres hai, we are taking a sagittal section like this. Okay, these are the two hemispheres. We are taking a sagittal section. That means we are cutting through the third ventricle. We are actually cutting through the third ventricle. That means this entire area that you're looking at is nothing but the third ventricle. Look at this. This entire area is the third ventricle. Fine, clear to all of you? So quickly tell me, what is the roof of the third ventricle formed by? Chalo, start now. What is the roof of the third ventricle formed by? Yes, answer this. Roof of the third ventricle is formed by this. What is this? What is this? Fornix. The roof of the third ventricle is formed by fornix. The floor is formed by optic chiasma, pituitary stalk, mammillary body. Anterior wall is formed by the anterior commissure and the lamina terminalis. The posterior wall is formed by the pineal gland, the posterior and the habenular commissure. And the lateral walls are formed by thalamus and hypothalamus. That's it. So thalamus and hypothalamus comes in the lateral wall of the third ventricle. Bas itna yaad rakho. Now this third ventricle is going to communicate. What is this here? Ye septum pellucidum hai. If you break this septum pellucidum and we go on that side, lateral side, we go in a very big cavity. What is that? Lateral ventricle. ठीक है ना? If you break this septum pellucidum and आप lateral side पे जाओगे तो we go in a very big cavity. That's a lateral ventricle, and this lateral ventricle is communicating with the third ventricle. What is this arrow? What is this arrow? The lateral ventricle is communicating with the third ventricle through. Come on, students. Come on. The lateral ventricle is communicating with the third ventricle through. No. Arrow. What is that arrow? What is that arrow? Come on, students. Come on. That's the foramen of Monro. That's the interventricular foramen of Monro. Yes, very good. So the lateral ventricle communicates with the third ventricle through the foramen of Monro, and the third ventricle communicates with the fourth ventricle through ye kya hai? Aqueduct of Sylvius. Aqueduct of Sylvius. Okay. So just remember that's how the CSF is going to flow. Yeah, this is the fourth ventricle. Yahan pe fourth ventricle hai. So fourth ventricle clear. Third ventricle clear hai. So this is third ventricle comes as a short note. You have to draw this diagram. You have to write about the boundaries, the communication of the third ventricle. Agar ye block ho jata hai, so there's enlargement of the ventricles, and this is what we call as a hydrocephalus. Fine. Coming to the fourth ventricle. Fourth ventricle ka floor is formed by what? Floor is formed by the pons and the medulla, and the roof is formed by the cerebellum. Fourth ventricle, the floor is formed by pons and medulla, the roof is formed by the cerebellum, and what is this? The superior and the inferior medullary velum. Superior and the inferior medullary velum. Great. Mohammed, great. Fine, very nice. Chalo. We'll come to this. Okay, so that's how the third ventricle is. This is the lateral ventricle. What is this? This is the foramen of Monro. This is the aqueduct of Sylvius. That's the fourth ventricle. ठीक है? तो ये सब अच्छे से पढ़ लो, gross अच्छे से पढ़ लो. Your practicals will always be very easy. Now coming to the fourth ventricle, this is the fourth ventricle here. So what is the roof of the fourth ventricle formed by? Cerebellum. The floor is formed by the pons and the medulla. The pons and medulla is going to form the floor of the fourth ventricle. Akshat, epithalamus में the pineal gland, the posterior commissure and the habenular commissure together forms the epithalamus. Pineal gland, habenular commissure, posterior commissure. That is epithalamus. Hi, good evening, Samayak. Great. Good. Okay. The papers were very good. Okay. Now coming to the fourth ventricle. We'll come to the fourth ventricle first. Chalo. What is this? This is the fourth ventricle. So, ye kaun hai? Cerebellum. Cerebellum is going to form what for the fourth ventricle? The roof of the fourth ventricle. That is formed by the cerebellum, the superior medullary velum. And what is this now? This is the floor of the fourth ventricle. The floor of the fourth ventricle is divided into two parts. दो parts में divide करता है. This is formed by the pons and this is formed by the medulla. Now, which half of pons and which half of medulla? It's the lower half of pons and the upper half of medulla. Lower half of pons and the upper half of medulla forms the floor of the fourth ventricle. What is this aspect? Ye kya aspect hai? That's a dorsal aspect. Can anyone tell me what is this number 1, what is this number 2, and what is this 3? Chalo bolo bachcho. What is number 1, number 2, and 3? Answer this. Okay, answer this. Main parts of fourth ventricle, even if you remember, that's fine. That's fine. What is this one? You're looking from the dorsal aspect, and a dorsal aspect se dekh rahe ho. Ye sab practicals mein bhi पूछते हैं. All this is asked in practicals. You're looking from the dorsal aspect, that's a medulla. What is this number 1? There's a tract which is climbing up. On the dorsal aspect of medulla, that's a fasciculus gracialis. This is the nucleus gracialis. Number one is the nucleus gracialis. बाजू में होता है fasciculus cuneatus, and that becomes the nucleus cuneatus. And number three is the inferior cerebellar peduncle. Pyramids नहीं है वो बच्चों. Pyramids is on the anterior side. Richa, pyramids is on the anterior side. Sufyan, समझ में आ रहा है ना? ये डॉर्सल एस्पेक्ट से देख रहे हो. अगर सामने से देखते हो, इफ यू लुकिंग फ्रॉम द वेंट्रल एस्पेक्ट, इफ यू लुकिंग फ्रॉम द एंटीरियर एस्पेक्ट, तब पिरामिड्स दिखेंगे, तब ऑलिव्स दिखेगा एंड इंफीरियर सेरेबेलर पेडंकल दिखेगा. नाउ यू लुकिंग फ्रॉम बैक साइड, सो फर्स्ट यू गेट द fasciculus gracialis and the nucleus gracialis, fasciculus cuneatus, the nucleus cuneatus and the inferior cerebellar peduncle. Fine, clear to all of you? Okay, so now we come to the fourth ventricle. Just the important points. What is this? Okay, that's the fourth ventricle. This is how you're going to draw this. Now tell me, what is this known as? Ye kaun hai? What is this? This fourth ventricle is divided into two parts by, what is this? A, come on students, come on. That's fine, that's fine. It's a learning process, bacho. It's always a learning process. That's fine. Bolo, I mean the fourth ventricle is divided into pons and a medulla by, what are those fibers known as? Any guesses? What are these fibers known as? Come on students, that's a quick revision for you. Come on, you can answer this. Stria medullaris, very good. So these fibers are known as stria medullaris, stria medullaris. What is this in the center? That's a median sulcus. That's a median sulcus. Ye kya hoga? What is this known as? This is known as the sulcus limitans. Sulcus limitans. Fine. Ye upar kya hai? What is this above? What is this above and what is this below? What do you call this as? Sulcus limitans. What is this above and what is this below? Any guesses? Come on, students. Fine. Sulcus limitans ke upar aise, that is known as the superior fovea. Superior fovea. This is the superior fovea. This is the inferior fovea. Inferior fovea. Fine. This is the median eminence. Ye dono sides pe, that's a median eminence. Fine. So this is the median sulcus. This is the sulcus limitans. That's a median eminence. Superior fovea, inferior fovea. Fine. Locus ceruleus, wahi pe hai. Locus ceruleus is also there. Now you tell me, in the pons, we get two rounded bodies here. What are these rounded bodies known as? This one. What is that known as? This is the facial colliculus. Facial colliculus. And this facial colliculus is formed by whom? Who forms this facial colliculus? Yes, who forms this facial colliculus? It is formed by the fibers of which nerve winding around which nucleus? These are formed by the fibers of facial nerve as they wind around the abducens nucleus. The fibers of facial nerve as they wind around the abducens nucleus. So that's a facial colliculus. That's the facial nerve ka nucleus. That's the nucleus of the facial nerve. That's the nucleus of the abducens nerve. And the fibers of facial nerve, when they turn like this, they form an elevation here, and this is what we call as the facial colliculus. Facial colliculus. So facial colliculus is formed by the fibers of facial nerve as they wind around the abducens nucleus. So MCQ aata hai, damage to the structure beneath the facial colliculus would result in paralysis of which muscle? Can you answer this? Damage to the structure beneath the facial colliculus results in paralysis of. Answer this. Bolo. Damage to the structure beneath the facial colliculus. Matlab beneath the facial colliculus, who's that? The abducens nucleus. So abducens nucleus damage ho gaya. So which muscle is paralyzed? Answer this. Tukaram. No. Facial nerve nahi hai bachche. That is lateral rectus. Lateral rectus hai bachche. Lateral rectus. Damage to the structure beneath the facial colliculus. Ab facial colliculus kaun banata hai? Facial colliculus is formed by the fibers of facial nerve, and beneath that is the abducens nucleus. So damage to the abducens nucleus results in paralysis of lateral rectus. Lateral rectus. The person will get a medial squint. Lateral rectus paralyzed ho gaya, to medial squint hoga. Medial squint. Fine. and damage to the structure causing the facial colliculus results in paralysis of. Damage to the facial colliculus or the structure causing the facial colliculus, that's facial nerve. So that will result in paralysis of rhizorius. वो option में होता है rhizorius. That was a PG NEET question also. समझ में आया ना बच्चों? Is this clear to all of you? Can anyone tell me what is the name of this nucleus of facial nerve? What is the name of the nucleus of facial nerve which supply, I mean this nucleus of facial nerve? Facial palsy. Yes. Suresh, fine. Bachcho, I just want the name of this nucleus of facial nerve. Answer. So automatically the cranial nerve nucleus gets revised. And automatically cranial nerve के nucleus revise होंगे आपके. Answer this. What is the name of this nucleus of facial nerve which forms the facial colliculus? नहीं बच्चे, नहीं. Solitarius नहीं है बच्चे, no. It is not nervus intermedius. Nervus intermedius नहीं है. Akshad. It's the motor nucleus of facial nerve. Yes, that's a motor nucleus of facial nerve. And ये जो motor nucleus of facial nerve है, what is it going to supply? It supplies the muscles of second pharyngeal arch. This is the motor nucleus of facial nerve, and this motor nucleus of facial nerve is going to supply the muscles of second pharyngeal arch. ये कौन से component को represent करता है? स्ट्रक्चर बीनीथ द फेशियल कॉलिकुलस बोला ना शंतनु, स्ट्रक्चर बीनीथ द फेशियल कॉलिकुलस है तो एब्डोसेंस न्यूक्लियस आता है. ओके फाइन. व्हाट वाज आई आस्किंग यू? हाँ, so this is the motor nucleus of facial nerve which supplies the muscles of second pharyngeal arch. And what is that functional component? वो कौन सा functional component है which supplies the muscles of pharyngeal arches? Anyone? The name of the component is special visceral efferent component. Special visceral efferent. So ये जो special visceral efferent component है, this is going to supply the muscles of the pharyngeal arches. So which are the nerves of the pharyngeal arches? Fifth. First arch ki nerve, fifth, second arch, seventh, third arch is ninth, and the fourth and sixth is 10th nerve. 10th nerve. Understand? So this component is present in which nerves? Fifth, seventh, ninth, and 10th. समझ में आ रहा है? So special visceral efferent component क्या supply करता है? What does it supply? The muscles of the pharyngeal arches. So this component would be present in which nerves? Which is the nerve of the first arch? Trigeminal. Nerve of the second arch? Facial. Nerve of the third arch? Glossopharyngeal. And fourth and sixth is vagus. Okay, can you tell me the names of this nucleus? इसका nucleus का नाम बताओ. Name of this nucleus which belongs to this functional component. मतलब the name of the nucleus of trigeminal nerve which belongs to the special visceral efferent component. This is the motor nucleus of trigeminal nerve. This is the motor nucleus of facial nerve. And for the 9th, 10th and the cranial accessory, 9th, 10th and cranial accessory, there's a common nucleus. This is nucleus ambiguous. That's nucleus ambiguous. Spinal नहीं है बच्चे. Cranial accessory वो, cranial accessory. So for the fifth nerve, the nucleus is motor nucleus of trigeminal nerve. For the seventh, it's the motor nucleus of facial nerve. And for the 9th, 10th, and 11th, that's the nucleus ambiguous. समझ में आ रहा है ये? Are you able to follow this? हाँ, clear. So any other nucleus of facial nerve can you tell me? एक तो ये हो गया, that's a motor nucleus of facial nerve. और भी कोई nucleus of facial nerve है which you know? Any other nucleus of facial nerve do you know? I mean, see, you just have to know what is the nerve supply. What is the facial nerve supply? If you know like this, automatically nucleus आ जाता है, automatically functional components आ जाते हैं. So number one, facial nerve supplies the muscles of second pharyngeal arch. Fine. To supply the muscles of second pharyngeal arch, component क्या है? Special visceral efferent component है. The name of the nucleus is motor nucleus of facial nerve. Anything else is the facial nerve supply? The glands. Facial nerve supplies all the glands except Tukaram, nahi. Facial nerve supplies all the salivary glands except, answer this. Facial nerve supplies all the glands except, except bolo. You should be able to answer this. Parotid, very good. Facial nerve supplies all the salivary glands except parotid. हाँ, parotid को कौन supply करता है? Glossopharyngeal nerve. Now you tell me to supply the glands. अगर किसी nerve को glands को supply करना है, if any nerve has to supply the glands, what is the functional component to supply the gland? What is the functional component to supply the gland? It's the general visceral efferent. General visceral efferent, right? Now this general visceral efferent component is going to supply the glands. Fine. So which nerves will have this component? Which nerves will have this component? 7, 9, 10. 7, 9 and 10. What glands is the seventh nerve supply? All the glands except parotid. All the glands. What is the name of the nucleus? That's a superior salivatory nucleus and lacrimatory nucleus. Superior salivatory and lacrimatory nucleus. For the ninth nerve, supplies the parotid gland, inferior salivatory nucleus. And for the 10th nerve, that's a dorsal nucleus of vagus. Dorsal nucleus of vagus कौन से glands को supply करेगा? The glands of GIT. The glands of GIT. Fine. This general visceral efferent component is going to supply what? It is going to supply the glands. बस ये याद रखना है आपको. So this component would be present in which nerves? The 7th nerve, which supplies all the glands except parotid. The 9th nerve, which supplies the parotid, and the 10th nerve, which supplies the glands of GIT. एक exception है. एक exception है. There's a nerve which does not supply any gland, but still this nerve has got this component. Which is that nerve? That's a third nerve. That's a third nerve. And the third nerve does not supply any gland, but वो दो muscles को supply करता है, which is sphincter pupillae and ciliaris. Sphincter pupillae and ciliaris muscle. The name of that nucleus is Edinger-Westphal nucleus. Edinger-Westphal nucleus. समझ में आ रहा है ये? Edinger-Westphal nucleus. बस वो exception है. Third nerve does not supply any glands, but still it has got this component because it represents the parasympathetic nervous system. बच्चों ये I am telling you directly, हाँ थोड़ा सा difficult, मतलब if you are listening for the first time थोड़ा सा difficult लगेगा, but this is how you are going to remember this. Fine, clear to all of you? So third nerve के दो nucleus होंगे. One nucleus to supply the extraocular muscles and the second nucleus to supply the sphincter pupillae and ciliaris muscle. The nucleus which supplies the extraocular muscle is the oculomotor nucleus, and the nucleus which supplies the sphincter pupillae and ciliaris is the Edinger-Westphal nucleus. समझ में आ रही है? Are you all able to follow this? Can you correlate this? Okay, एक last component बाकी, I'll finish that. The third component is going to supply the muscles which are derived from occipital myotomes. Occipital myotomes. Myotomes. The third component is going to supply the muscles derived from occipital myotomes. Which are these muscles derived from occipital myotomes? These are the extraocular muscles and tongue muscles. Extraocular and tongue muscles. Extraocular and tongue muscles. So now you tell me, what is the name of this component? The name of this component is general somatic efferent. General somatic efferent. And this general somatic efferent component is present in which nerves? Bolo. Three, 4, 6 and 12. Okay. General somatic है बच्चे, special somatic नहीं है. It's general somatic. General somatic efferents. Okay, clear now to all of you. अब clear है, third nerve will have two major components. Third nerve में दो major components है. Third nerve is going to supply the muscles, all the extraocular muscles except LR and SO, lateral rectus and superior oblique. So that component is general somatic efferent. The third nerve also supplies what? It also supplies the sphincter pupillae and ciliaris. तो उसका nucleus है Edinger-Westphal nucleus. Okay, that's how you're going to correlate. But if you understand this now, it's beautiful. I mean, it's very nice. ठीक है? No, don't start with this revision lectures. Suyesh, ये revision lectures है. These are only revision lectures. इसमें you'll not understand things. ठीक है बच्चों, clear to all of you? Okay, so coming back to this, tell me now, what is this? ये क्या था? What was this? This is the facial colliculus. Tell me, what is this A and what is this B? What is this A and B? स्पेशल सोमैटिक इफरेंट ऐसा नहीं है बच्चे. स्पेशल सोमैटिक इफरेंट ऐसा नहीं है बच्चे. Okay, what is this A and what is this B? That is vagal and hypoglossal triangle. That's a vagal triangle. This is the hypoglossal triangle. That's a vagal triangle. Hypoglossal and vagal triangle. Fine. What is this? What is this? C and D. What is this C and D? And what is this E? बोल सकते हो? हाँ, very good. What is C, D and E? ये सब है ना, ब्रेन स्टेम इज केप्ट इन द प्रैक्टिकल्स. आप ब्रेन स्टेम प्रैक्टिकल में रखेंगे. यू हैव टू नो ऑल दिस थिंग्स. सो कौन सा एस्पेक्ट देख रहे हो? आर यू लुकिंग फ्रॉम द डॉर्सल साइड और आर यू लुकिंग फ्रॉम द ventral aspect? That you have to know. So what is C? Superior colliculus. What is D? Inferior colliculus. And E is the trochlear nerve. Trochlear nerve. The only cranial nerve which emerges from the dorsal aspect is trochlear. Only cranial nerve which emerges from the dorsal aspect is trochlear nerve. Fine. What is this? ये क्या है? ये star. What is that star? Cyan brachium ये है. This is the brachium. ये brachium है. What is that star? What is that star? Pineal gland. That star is the pineal gland. Very good. Star is the pineal gland. Okay, very good. Can anyone tell me what is this? What is this? I'll put Z. ये क्या देख रहे हो? What is that Z? वो Z क्या nucleus है? बोल सकते हो? What is that nucleus? That's a nucleus of cerebellum. Z. Very good to all of you. अब वो दिख रहा है. It is seen, so I'm asking you. What is that Z? Any guesses? Dentate nucleus. Very good, Lavisha. That's a dentate nucleus. Yes. Adnan. Very good. Aditya. Adnan, you're there. Good. फाइन, दैट्स अ डेंटेट न्यूक्लियस. ठीक है, तो इतना आप लिख सकते हो फोर्थ वेंट्रिकल में. सो फोर्थ वेंट्रिकल का रूफ, फ्लोर, मीडियन सल्कस, सल्कस लिमिटेंस, मीडियन एमिनेंस, ट्राया टर्मिनालिस, सुपीरियर इंफीरियर फोविया, ऊपर एक लोकस सेल्युलरिस होता है. हाँ, लोकस सेल्युलरिस. द ब्लूइश कलर डिस्कलरेशन अबाउट इज लोकस सेल्युलरिस. इट कंटेन्स अ पिगमेंटेड सब्सटेंस व्हिच इज नोन एज सब्सटेंशिया फेरुजिना. फिर ये फेशियल कॉलिकुलस के बारे में लिखना है. देन यू हैव टू राइट अबाउट द हाइपोग्लोसल एंड वेगल ट्रायंगल्स. फाइन. ओके, this is all clear. Now you tell me, where is this section? एक minute, we'll just come to this. Sections पे आते हैं. We'll start with the brainstem first. Brainstem देखते हैं. We'll start with the brainstem. Tell me, what is this aspect of the brainstem? The same brainstem will be kept in your practical exam also. इसमें बहुत MCQs आते हैं. Plenty of MCQs on this. Tell me, what is this view? कहाँ से देख रहे हो? Where are you looking this from? Very important. Bachcho, come on. Where are you looking this from? This is from the ventral aspect. Very good, Tukaram. And why is this ventral aspect, Bachcho? Why is this ventral aspect? A very common question which is asked in the Vivas also. Why is this ventral? Ventral or anterior? Same. Because all the cranial nerves are emerging from the ventral aspect of the brainstem. बच्चों याद रखना, all the cranial nerves come out from the ventral aspect of the brainstem except the trochlear nerve जो dorsal aspect से आती है. The only cranial nerve which comes from the dorsal aspect is the trochlear nerve. बाकी जितने भी cranial nerves हैं, they all emerge from the ventral aspect of the brainstem. Fine? हाँ, that's not the answer. Fine? Okay, now we start. Tell me, what is this? This is number, this is A, this is B, this is C, D, E, F. चलो answer this much first. ये पहले answer कर लो. So what is A and B? A is oculomotor nerve. Oculomotor nerve. What is B? B पीछे से आ रही है. That's a trochlear nerve. So A है oculomotor nerve, B है trochlear nerve. So the oculomotor and the trochlear nerve are attached to the midbrain. ये है midbrain. This is the crus cerebri. Oculomotor nerve and trochlear nerve are attached to the midbrain. Where is the nucleus of oculomotor nerve located? बोल सकते हो? Where is the nucleus of this oculomotor nerve located? Nucleus कहाँ पे होता है? Nucleus of oculomotor nerve is in the midbrain at the level of superior colliculus. Oculomotor nerve का nucleus is in the midbrain at the level of superior colliculus. ये याद रहेगा? Will you be able to recollect this? Remember this? Where is the nucleus of trochlear nerve? The nucleus of trochlear nerve is in the midbrain at the level of inferior colliculus. This you should know. This you should know. Nucleus of trochlear nerve. Trochlear nerve का ये brainstem का attachment है. But where is the nucleus? Nucleus is in the midbrain at the level of inferior colliculus. Inferior colliculus. Fine. ये याद रखना. Okay, now coming to C. What is the C? That's a trigeminal nerve. Trigeminal nerve. So ये है pons and ये क्या है? What is this structure? This is the middle cerebellar peduncle. ये है middle. Okay, just one moment. Okay. There's some disturbance in between. Okay. Topics. I'll tell you. Important topics at the end, I'll tell you. At the end. Chalo bachcho, tell me what is this? What is this known as? What is this known as? This is the pontomedullary junction. Pontomedullary junction. Fine. That's a pontomedullary junction. Now you tell me what are these nerves? What are these nerves? Chalo, we'll start. What is this? 1, 2, and 3. Come on, answer this. Pontomedullary junction. What are the nerves? There is some issue. That's fine. What is this? 1, 2, and 3. 6, 7 and 8 nerve. 6, 7 and 8 nerve. ये सब practical के लिए important है. ये सब practical के लिए important है बच्चों. ये सब पूछते हैं. Brainstem is kept in the exams. हाँ, तो ये अच्छे से पढ़ना. 6, 7 and 8. This is the 6th nerve. This is the 6th nerve. That's a 7th nerve, and that's the 8th nerve. 6, 7 and 8 nerve. Fine. What is this? Yeah, ये कौन है? This is the 9th, 10th, and this is the cranial accessory, and that's a 12th nerve. That's a 12th nerve. So 9th, 10th, and the cranial accessory, and that's a 12th nerve. What is this? This is the spinal accessory. Spinal accessory. Fine. A quick accessory nerve के बारे में देखते हैं. A quick go through the accessory nerve. So now you tell me, बच्चों, the cranial accessory. Origin, the cranial accessory arises in the medulla along with the 9th and the 10th cranial nerves. The name of the nucleus is a nucleus ambiguous. Nucleus का नाम है nucleus ambiguous. Fine. The spinal accessory originates in the spinal cord, the upper cervical segments of the spinal cord. That's the spinal accessory. Now, this spinal accessory nerve, how does it enter the skull? Answer. Spinal accessory has to go and join the cranial accessory. Cranial accessory skull के अंदर है. Spinal accessory skull से बाहर है. So how does the spinal accessory enter the skull? Answer, students, answer. Foramen magnum. Yes. So the spinal accessory enters the skull through the foramen magnum, joins with the cranial accessory, forms a complete accessory nerve. अब ये पूरा accessory complete accessory nerve बन गया. How does this accessory nerve leave the skull? How does this accessory nerve leave the skull? Through the jugular foramen, middle compartment of jugular foramen, 9, 10, 11 cranial nerves. Okay, so this accessory nerve leaves the skull through the middle compartment of the jugular foramen. जैसे ये skull से बाहर आते हैं, it divides into again a cranial and a spinal part. Fine. The spinal accessory first supplies the sternocleidomastoid, comes in the posterior triangle of the neck, lies on the levator scapulae and goes to supply the trapezius. This you know. So this spinal accessory nerve is very superficial in the posterior triangle of the neck. So if there's any surgery going on in the posterior triangle, the spinal accessory nerve can get damaged. Trapezius is paralyzed. Fine. What happens to the cranial accessory? The cranial accessory goes and joins the vagus. Vagus के साथ join होता है, and जहाँ जहाँ vagus जाता है, the fibers of cranial accessory are distributed through the vagus. हाँ, yes रवि, yes. ठीक है, बाद में पूछना doubts. Fine, clear to all of you? It forms a plexus. It forms a plexus जिसका नाम है pharyngeal plexus. It forms a plexus which is known as pharyngeal plexus. Pharyngeal plexus is formed by the pharyngeal branch of vagus with the cranial accessory, the pharyngeal branch of glossopharyngeal nerve and a branch from the superior cervical ganglion. उसे बोलते हैं pharyngeal plexus, or it is known as the vago-accessory complex. Vago-accessory complex. Fine. Just quickly tell me, this pharyngeal plexus or the vago-accessory complex supplies all the muscles of the soft palate except, it supplies all the muscles of soft palate except, come on, a quick revision. The pharyngeal plexus supplies all the muscles of soft palate except. answer, yes. Prabhu, Tukaram, yes. No. Harshini, no. Except tensor palate, you got this. Tensor palate, bache, tensor palate, levator nahi hai. It's the tensor palate which is supplied by the mandibular nerve through the nerve to medial pterygoid. ये exception सब याद रखना, ये सब पूछते हैं एग्जाम्स में. Everything is asked. Fine, I'm just looking at what you're answering. So all the muscles of soft palate are supplied by pharyngeal plexus except the tensor palate which is supplied by the mandibular nerve through the nerve to medial pterygoid. What else does the pharyngeal plexus supply? It supplies all the muscles of, all the longitudinal muscles of the pharynx except. Pharyngeal plexus supplies all the longitudinal muscles of the pharynx except stylopharynges, which are supplied by glossopharyngeal nerve. It supplies all the circular muscles of the pharynx except, बोल सकते हो, supplies all the circular muscles of the pharynx. ये मैंने बोला था आपको pharynx में, except, हाँ, except the cricopharyngeus part of inferior constrictor, which is supplied either by external or by recurrent laryngeal nerve. Fine. तो ये सब याद रखना. Remember all these things. These are very important. Very important. ठीक है? Okay. चलो, students. Now let us understand this. ये ना sections एक बार समझ लो. I'll just tell you in brief the sections. Fine. Clear with all these things? Everything is important. Neuroanatomy जितना theory करोगे अच्छे से उतना your practicals are going to be perfect. Fine. Everything is the same. Okay. Now we take a sections. अब sections लेते हैं. We take sections through the medulla, section through the medulla, ऐसे. We take the section through the pons. We take section through the midbrain. ठीक है? So we taking sections. Fine. Now you tell me medulla is divided into two half. एक मिनट, just one moment. We are taking section. अगर यहाँ से section लेते हैं, if we take a section from here, what you get? What cavity do we get? अगर यहाँ से section लेते हैं medulla से, so what is the cavity that you are going to get in the medulla? Cavity क्या होगा? Cavity बोलो. Central canal. ये fourth ventricle है ना, fourth ventricle के बाद you get the central canal. So if I take a section from here, from the lower half of medulla, this is the lower half. इतना अपना medulla है. This much is our medulla. If I take a section here, this is the lower half of medulla. I take a section here, this is the lower half of medulla. I get the central canal. If I take a section here, I get the fourth ventricle. I get the fourth ventricle. समझ में आ रहा है? मतलब if I get the fourth ventricle in the medulla, मतलब section कहाँ से लिया है? Upper half of medulla से. If I take a section through the medulla and I get the central canal, that means it's in the lower half of medulla. Fine. अगर मैं यहाँ से section लेता हूँ, this is the lower half of the pons. You get fourth ventricle. If I take a section here, this is the upper half of the pons, जहां पे fourth ventricle close होता है. Fourth ventricle close होता है. समझ में आ रहा है बच्चों? Are you able to follow this? Are you able to follow this? See, एक मिनट वापस देखो. This is the fourth ventricle. So what is this? This is the pons, and this is the medulla. Pons and medulla. But our medulla, इतना. This is the lower half. This is the upper half of medulla. This is the upper half of pons and lower half of pons. So where is the fourth ventricle located? In the lower half of pons and the upper half of medulla. तो अगर मैं यहाँ से section लेता हूँ, what do I get? Central canal. Fine. If I take a section from here, what do I get? I get the fourth ventricle. If I take a section from here in the pons, I get the fourth ventricle, facial colliculus. If I take a section from here, the fourth ventricle closes. That is upper half of the pons. If I take a section here, that is the section of the midbrain at the level of inferior colliculus. यहाँ पे कौन सा nucleus मिलेगा? कौन सा nucleus मिलेगा? And if I take a section here, I get the nucleus of third nerve, and I get the nucleus of fourth nerve here. Fine. So बच्चों, let us start with the sections. चलो. Tell me, where is this section? Where is this section taken? What is this? ये कौन है? Central canal. So this is the section of the lower half of medulla. Section of the lower half of medulla. What are these fibers which are crossing here? ये कौन से fibers cross कर रहे हैं? This is the pyramidal decussation. That is the tiers of medulla at the level of pyramidal decussation. Fibers cross. हाँ, ये corticospinal tract cross होता है ना यहाँ पे. Fine. What is this? This is the fasciculus gracialis and this is the fasciculus cuneatus. Fasciculus gracialis, fasciculus cuneatus. अब ये कौन है? What is this? This is the nucleus gracialis and that's a nucleus cuneatus. Nucleus gracialis and nucleus cuneatus. This is the spinal nucleus and tract of trigeminal nerve. Spinal nucleus and tract of trigeminal nerve. अब इसके ऊपर सेक्शन लेते हैं. जैसे इसके ऊपर सेक्शन लोगे तो this fasciculus will over, this fasciculus will end. And ये nucleus gracialis and nucleus cuneatus दिखेगा. So that's a nucleus gracialis, that's a nucleus cuneatus. Fasciculus खत्म हो गया. Where is this section? This is a section taken through the lower half of medulla. Lower half of medulla. This is a nucleus gracialis, that's a nucleus cuneatus. अब इसके ऊपर अगर section लेते हैं, we take a section about this. So that is going to be the fourth ventricle. That is going to be the fourth ventricle. So this nucleus gracialis and cuneatus, these are the second order neuron for fine sensations. याद है? Second order neuron for fine sensation is nucleus gracialis and cuneatus. Fibers have to go up, but they cannot go up because about this is the fourth ventricle. So what do the fibers do? The fibers come here, they cross here, and this is the section of the medulla at the level of sensory decussation. That's the sensory decussation. Fibers cross करते हैं, they form a tract here. बोलो, what is the name of this tract? ये tract का नाम बोलो. What is the name of this tract? And this crossing is known as internal arcuate fibers. These are the internal arcuate fibers. What is this tract? Tract का नाम बोलो. Tract का नाम बोलो. What is the name of this tract? You should know this. You should know this tract. That's a medial lemniscus. Yes, you got this. That's a medial lemniscus. Very good. Medial lemniscus. ठीक है? तो पहला section क्या था? This was the section of the medulla. बहुत नीचे है at the level of pyramidal decussation. ये fasciculus gracialis, nucleus gracialis दिखता है. About this you take a section. The fasciculus is over. The fasciculus relays in the nucleus gracialis and cuneatus. Up the fibers cross. They cross and they form a tract which is known as the medial lemniscus. Fine. This is the central canal. This is the dorsal and the ventral horn. ये देखो. एक मिनट, just try to understand. That's the central canal. This is the dorsal horn. This is the ventral horn. Spinal cord कैसे है? Spinal cord. Dorsal horn, ventral horn. That's the central canal. now as we go about this, जैसे इसके ऊपर जाते हैं, this dorsal horn opens up, the dorsal horn opens up, and the central canal now becomes what? The fourth ventricle. That becomes a fourth ventricle. Okay, so this is dorsal, this is ventral. Now the dorsal horn will open up. The dorsal horn opens up, so this is dorsal horn and this is ventral horn. ये ऐसे था, ऐसे समझ में आ रहा है? So it was like this. ये dorsal and ये ventral and ऐसे था. So the dorsal horn opens up and the central canal now becomes the fourth ventricle. ये बन गया fourth ventricle. Understanding? हाँ, accessory cuneate nucleus. वैभव बोलता हूँ वो बाद में बोलता हूँ, पहले मेन चीजें देख लेना. Just first see the main things. Fine. Now you tell me what is here. What is here in this gray matter? In this gray matter, what do you get? This is the hypoglossal nucleus. This is the dorsal nucleus of vagus. And this is the nucleus of tractus solitarius. ये कहाँ पे है? This is in the gray matter. ये dorsal horn, ये ventral horn, ये gray matter के अंदर है. Now, as this dorsal horn opens up, as the central canal becomes the fourth ventricle, ये जितने भी nucleus है, all this nucleus will come to lie in the floor. Look, this is open. All this nucleus comes to lie in the floor, and in the floor they form elevations. In the floor, ये elevations बनाते हैं. This is what we call as the hypoglossal triangle. This is what we call as the vagal triangle. Understanding? Yes. Understood? So how the hypoglossal and vagal triangle are formed? तो पहले where are they? They are in the gray matter. And जैसे ये gray matter खुल जाता है, all this nucleus comes to lie in the floor of the fourth ventricle. They form elevations, and this elevations is what we call as the triangles. Fine. So medulla is over. Medulla is over. This is the upper half of the medulla. So medulla खत्म हो गए. अब इसके ऊपर जाते हैं. I'm just telling you how to identify the sections, हाँ बच्चों. Now we go about this. We go about this. Hey, where are we? Where are we? What's this? The moment you see this, facial colliculus, you should know that we are in the lower half of the pons. We are in the lower half of the pons. That's a fourth ventricle. ये fourth ventricle है. That means we are in the lower half of the pons. समझ में आ रहा है ये? अब इसके ऊपर सेक्शन लेते हैं. We take a section about this. The fourth ventricle is going to close. The fourth ventricle closes. Look, the fourth ventricle is closed. This is the upper half of the pons, and this is the nucleus of fifth nerve. That's the nucleus of fifth nerve. So where is the nucleus of fifth nerve located? That's in the upper half of the pons. Fine. So pons is over. Lower half में कौन से nucleus थे? Sixth and seventh nerve के nucleus है, and above is the fifth nerve का nucleus. This is over. Now we go about this. What is this? ये क्या है? The moment you see this going like this, what is this? Answer this. You should be able to identify this. What is that structure जो क्रॉस कर रहा है ऊपर? That's a trochlear nerve. That's a trochlear nerve. So this is, and what is this? ये कौन है? Aqueduct of Sylvius. That's the aqueduct of Sylvius. So where is this section taken? It is taken at the midbrain, at the level of inferior colliculus. At the level of inferior colliculus, fine. And then you've got this at the level of superior colliculus. This is the oculomotor nucleus. That's the oculomotor nucleus. And इसके साथ होता है ये Edinger-Westphal nucleus. Oculomotor nucleus and the Edinger-Westphal nucleus. Fine, clear to all of you? Is this clear? Are you able to follow this? Clear? If you go above this, you will go in the third ventricle. इसके आगे third ventricle में जाओगे. Clear? Can anyone tell me what is this? What is this nucleus? ये क्या nucleus है? Important topics I'll tell at the end. Okay. What is this? What is this nucleus? Any guesses? This is the mesencephalic nucleus of the trigeminal nerve. Mesencephalic nucleus of the trigeminal nerve. वैसे trigeminal nerve के 3 न्यूक्लियस होते हैं. एक होता है mesencephalic nucleus which is in the midbrain. दूसरा होता है chief sensory nucleus. Chief sensory nucleus that's in the pons. And third is the spinal nucleus which is in the medulla. So through this 3 nucleus, the trigeminal nerve gets sensations from the entire body. पूरे body से sensations आते हैं. So mesencephalic nucleus midbrain में होता है, chief sensory nucleus pons में होता है, and there is the spinal nucleus which is present in the medulla. To this nucleus, the trigeminal nerve receives sensations from the entire body, and this component is known as general somatic afferent. General somatic afferent. Clear? Is this clear to all of you? Clear to all of you? Fine. So just understand this general somatic afferent. And there's a special somatic afferent. Special somatic afferent is first nerve, second nerve, and eighth nerve. This is not so important. Tell me what is special visceral afferent. Special visceral afferent, just remember the tongue. Just remember the tongue. Anterior 2/3 special sensation 7th nerve, posterior 1/3 9th nerve, and the posterior most part is 10th nerve. So what is this? Just block this person. Hello, the team, just block this person. He's disturbing so much. Okay, there's a common nucleus for the 7th, 9th, and the 10th nerve. What is this nucleus? What is this nucleus? This is the nucleus of tractus solitarius. That's the nucleus of tractus solitarius. Fine. Okay, that's the nucleus of tractus solitarius. Clear to all of you? Okay. So special visceral afferent, बस tongue याद रखना. Tongue का anterior 2/3 chorda tympani, posterior 1/3 is glossopharyngeal nerve, and the posterior most part is vagus, internal laryngeal. So that's the nucleus of tractus solitarius. बस इतना याद रखना. Clear to all of you? Clear with the components of the nucleus? Okay. Can anyone tell me what is this syndrome? ये क्या syndrome है? हाँ, क्लिनिकल्स बहुत आते हैं बच्चों, क्लिनिकल्स बहुत आते हैं. A 70 years person walks into, is brought into the OPD, walks into the OPD नहीं होगा, is brought in the emergency room with paralysis of the body on the right side. The tongue is paralyzed on the left side. Paralysis of tongue on the left side, the body is paralyzed on the right side, and there is loss of fine sensations on the right side. So this is a hypoglossal nucleus. So tongue is paralyzed on the same side. These are the corticospinal tracts. So body is paralyzed on the opposite side. नहीं, ये lateral medullary नहीं है. This is the medial medullary syndrome. This is medial medullary syndrome. Lateral medullary ये है. That's the lateral medullary syndrome. This is the medial medullary syndrome. Sorry, heading दिया है. Thrombosis of anterior spinal artery और thrombosis of vertebral artery. ठीक है बच्चों, ये कुछ syndrome, important syndrome याद रखना. Medial medullary syndrome याद रखना. Lateral medullary syndrome याद रखना. Lateral medullary syndrome is also very important. Lateral medullary syndrome में what is gone? The tongue. Lateral medullary syndrome में nucleus ambiguous is gone. So there's dysphagia, dysarthria. The spinal nucleus of trigeminal nerve is gone. So there is ipsilateral loss of sensations from the face. The spinothalamic tract is involved. So contralateral loss of sensations from the body. हाँ, ये याद रखना. And there is vestibular apparatus. So vertigo होता है, vertigo and giddiness. Fine. So that is lateral medullary syndrome. ये ना clinical questions बहुत आते हैं neuroanatomy के. Okay. Fine. Can anyone tell me what is this? What is this syndrome? बस ये बोलो. So which is this nerve? This is a 7th nerve ka involvement. 7th nerve. That's a 7th nerve. That's a 6th nerve. And this is the corticospinal tracts. So how will a person comes to you? How will a person come to you? 7th nerve gaya. 7th nerve is gone. So this is a... नहीं, Weber's नहीं है ये. Weber's नहीं है. What is this? ए, what is this section from? ये section कहाँ का है? बोलो, ये section कहाँ से लिया है? You can see this, no? ये the moment you see this, what is that? Facial colliculus. Facial colliculus मतलब section कहाँ से लिया है? Vaipo, very good. That is Millard-Gubler syndrome. Millard-Gubler syndrome. ये पॉन्स है बच्चों, ये पॉन्स है. फेशियल कॉलिकुलस मतलब वो पॉन्स है, मेडुला नहीं है, वो पॉन्स है बच्चे, वो पॉन्स है. फाइन, हाँ दैट्स अ पॉन्स. सो इसमें क्या होता है देखो, इसमें क्या होता है, 7 nerve is gone, 7 nerve. So entire half of face is gone. 7 nerve गया ना, it's a lower motor neuron paralysis of face. So ipsilateral paralysis of face, हाँ ipsilateral paralysis of face, ठीक है. 7th, 6 nerve is gone, 6 nerve. So ipsilateral paralysis of lateral rectus. Ipsilateral paralysis of lateral rectus leads to a medial squint. Leads to a medial squint. And corticospinal tracts gaya, so contralateral hemiplegia. So how will a person come to you? The person comes with paralysis of face, say on the right side, a right medial squint. So medial squint ho gaya, ipsilateral right side facial paralysis ho gaya, and paralysis of the body on the left side. So this is what we call as Millard-Gubler syndrome. Millard-Gubler syndrome, ये याद रखना, ठीक है बच्चों. दिस इज वेरी इंपॉर्टेंट. हाँ, Millard-Gubler syndrome, medial medullary syndrome याद रखना, lateral medullary syndrome याद रखना, Millard-Gubler syndrome याद रखना. ये 3-4 syndromes बस याद रखो. And the last one which we get here is this. What is this, you tell me? So third nerve is involved and corticospinal tracts are involved. Where is this section taken from? बोल सकते हो ये section कहाँ से लिया है? पहले ना बच्चों try to identify the sections. हाँ, कहाँ से लिया है section? This is Weber's syndrome. This is Weber's syndrome. So Weber's syndrome में क्या होता है? Weber's syndrome में third nerve is gone. So third nerve is gone. So paralysis of ipsilateral paralysis of all extraocular muscles except lateral rectus and superior oblique. So lateral rectus is intact. So ये क्या होगा? Lateral squint and superior oblique intact है तो diplopia होता है. Diplopia. So person will have a lateral squint, person will have diplopia, plus what is the third nerve also supply? Sphincter pupillae and ciliaris. So what happens is pupils are dilated and fixed. Pupils are dilated and fixed. ठीक है ना? Plus corticospinal tracts गया तो contralateral hemiplegia. Contralateral hemiplegia. Plus ptosis भी होता है. Ptosis. How does ptosis occur? Ptosis. Because of paralysis of levator palpebrae superioris. Paralysis of levator palpebrae superioris से ptosis होगा. So how will a person come to us? The person will have a paralysis of body on the left side. Suppose the paralysis, a lateral squint on the right side, diplopia, and the person will have ptosis on the right side, and the pupils are dilated and fixed on the right side. Passing marks 50% बच्चे, 50%. Clear to all of you? So ये 3-4 ये है ना कुछ syndromes है, वो याद रखना. Just don't remember everything. Just remember the main syndromes. Main syndromes. Fine. Then we come to this white matter of the brain. White matter of the brain. So white matter of the brain, 3 types of fibers याद रखना. Commissural fibers, projection fibers, association fibers. ये याद रखना. Commissural fibers क्या होता है? Which connect similar areas in the opposite hemisphere. This comes for MCQs also. Connect similar areas in the opposite hemisphere. The largest commissural fiber is corpus callosum. Any other commissural fiber? Anterior commissure, posterior commissure, habenular commissure. Fine. Then projection fibers, they project outside the brain. Example is fornix internal capsule. And the third one is association fibers. They connect different areas in the same hemisphere. Example is uncinate fasciculus. superior longitudinal fasciculus, inferior longitudinal fasciculus. Fine, ये याद रखिए. Now coming to the parts of the internal capsule. Internal capsule is an LAQ. LAQ आता है internal capsule का. So tell me, what is this? चलो answer this now fast. What is A, what is B, and what is C? And this is the internal capsule. Come on students, come on. Answer internal capsule, a very, very important topic. Chalo bolo. What's A, what's B, what's C? We are discussing the important topics. This is a horizontal section of the brain. A is caudate nucleus. Very good. A is caudate nucleus. B कौन है? B. Thalamus. B is thalamus. Very good. C. C is the lentiform nucleus. C is the lentiform nucleus. ये same section practicals में भी रखते हैं. Same section practicals में भी रखते हैं. So A is caudate nucleus. B is thalamus. C is lentiform nucleus. What is this D? ये D कौन है? D. This gray matter. What is this D? Answer this. D. हाँ, D कौन है? वो gray matter, gray matter. वो ऐसे ऐसे wavy gray matter है ना. What is that known as? That is insula. Insula. Insula है वो, insula. This is internal capsule. ये है external capsule. ये है insula and ये है extreme capsule. Okay, fine. Okay, what is this artery? ये artery कौन है? Can anyone tell me what is this artery? Very good. What is that artery? Vaibhav, very good. अरे ये कौन है? This is the corpus callosum. बराबर, ये corpus callosum है. What is this? Septum pellucidum. What is this? Fornix. Fornix. What is this artery? Sorry, that is claustrum. अरे sorry, वो claustrum है, claustrum. अक्षत, वही claustrum है, claustrum, not insula. I'm so sorry. That is D is claustrum. This is claustrum. बोलो. मिडिल सेरेब्रल आर्टरी नहीं है बच्चे. मिडिल सेरेब्रल आर्टरी कैसे होगा? वो anterior cerebral artery. That's anterior cerebral artery. Then fibers passing to the internal capsule, you have to know. Fibers passing to the internal capsule, याद रखना. Just tell me one MCQ. I'll tell you. The corticonuclear fibers pass through which limb of internal capsule? बोल सकते हो. Corticonuclear fibers pass through which limb of the internal capsule? Insula is in the temporal lobe. Hidden part of temporal lobe is insula. Corticonuclear fibers pass through which limb of the internal capsule? बाकी internal capsule आप पढ़ सकते हो. I'm not going to details of that. बस ये बोल दो. ये बोल दो. Corticonuclear fibers. Corticonuclear fibers, corticospinal fibers, optic radiation and auditory radiation. That was claustrum. Claustrum. Insula नहीं है वो, claustrum है. And उसके बाद आता है extreme capsule. Insula is a hidden part of the temporal lobe, insular cortex. That's a hidden part of temporal lobe. I'm so sorry for that. Okay, now you tell me, corticonuclear fibers pass through which limb of the internal capsule? Genu. Corticospinal fibers pass through the posterior limb. Optic radiation passes through the retro-lentiform part. And the auditory radiation passes through the sub-lentiform part of the internal capsule. Just remember this. ये ना clinical सवाल भी आता है. A person comes with a hemiplegia, paralysis of the right side of the body. On MRI, an artery is found to be thrombosed. हाँ, तो उस हिसाब से आएगा a clinical question. So corticonuclear fibers, corticospinal fibers pass through which limb of the internal capsule? Fine. And then the blood supply of the internal capsule. This we have done in the lectures also. Which is the main artery which supplies the internal capsule? The middle cerebral artery. The middle cerebral artery is the main artery which supplies the internal capsule. Baki anterior limb is also supplied by anterior cerebral artery, that is the recurrent artery of Hebenure. Recurrent artery of Hebenure which supplies the anterior limb. The genu is supplied by the middle cerebral artery and the internal carotid artery. हाँ, बाकी ये एक बार देख लो आप. Fine. So, but the main artery supplying the internal capsule is middle cerebral artery. Fine. Cerebellum generally nahi aata hai. Just remember the nucleus of the cerebellum, the dentate nucleus, nucleus globus, nucleus emboliformis, and the nucleus fastigi. Nucleus fastigi. This nucleus fastigi belongs to which cerebellum? Can anyone tell me nucleus fastigi belongs to which cerebellum? Cerebellum हम classify करते हैं ना depending on development. Archicerebellum, paleocerebellum, neocerebellum. Nucleus fastigi belongs to which cerebellum? Any guesses? Yes, nucleus fastigi belongs to archicerebellum. The dentate nucleus belongs to the neocerebellum. And nucleus globus and emboliformis belongs to the paleocerebellum. Paleocerebellum. Fine. Okay. Okay, just tell me, what is this? We get one lecture for practical, for a practical. तो उसमें ना सब slides दिखा दूंगा मैं. I'll show you the slides of histology and the important characteristics. Some embryology slides we'll see. Embryology के models we'll see. Very good, very good. What is this? Come on, students. Yes, answer this. What is this? This is the Purkinje cell. Purkinje cell. And the Purkinje cell is the only motor output from the cerebellum. Okay. So this is molecular layer. This is Purkinje cell layer. This is granular layer. The Purkinje cell is the only motor output from the cerebellum. Baki, the entire cerebellum is sensory in input. The Purkinje cell is the only motor output from the cerebellum, and it inhibits the deep cerebellar and the lateral vestibular nucleus. It inhibits the deep cerebellar and the lateral vestibular nucleus. Okay, then you need to know the cerebellar peduncle. What is this? This is the middle cerebellar peduncle. What are the fibers which pass through the middle cerebellar peduncle? Anyone? Fibers passing through the peduncles, एक बार देख लो. Superior, middle and inferior cerebellar peduncle. What are the fibers which pass through the middle cerebellar peduncle? That's a pontocerebellar fibers. Pontocerebellar fibers. हाँ, inferior cerebellar peduncle से कौन से fibers जाते हैं? Olivocerebellar, cuniocerebellar, vestibulocerebellar, reticulocerebellar. These are the ascending fibers. So you just change the names, that becomes the descending fibers passing to the inferior cerebellar peduncle. Middle cerebellar peduncle से जाते हैं pontocerebellar, and superior cerebellar peduncle से which are the fibers which goes? One is the anterior spinocerebellar, rubrocerebellar, and hypothalamocerebellar. ये fibers याद रखना. This fibers you remember, which are passing through the cerebellum, through the cerebellar peduncles. Fine. Okay, bachcho. Now we'll just quickly go through the cranial nerves. Cranial nerves, dentatothalamic and dentatorubral and dentatothalamic. वो सब दिया है मैंने lectures में वगैरह, वो एक बार देख लो. Okay, we'll just start with the facial nerve. Facial nerve. चलो ये nerves देख लेते हैं एक बार. Facial nerve. Tell me, what is the facial nerve supply? You tell me the components and the nucleus. So, the facial nerve is a nerve second pharyngeal arch. Second pharyngeal arch. To supply the muscles of second pharyngeal arch, what components does it require? What is the component to supply the muscles of second pharyngeal arch? Special visceral efferent component. What is the name of the nucleus of the facial nerve belonging to this component? The name of the facial nerve is motor nucleus of facial nerve. Motor nucleus of facial nerve. What facial expression नहीं बोलेंगे, muscles of second pharyngeal arch बोलोगे. What else does the facial nerve supply? The facial nerve supplies all the glands. So this is general visceral efferent, supplies all the glands except parotid. Name of the nucleus is superior salivary nucleus and lacrimatory nucleus. Superior salivary and lacrimatory nucleus. What else is the facial nerve supply? The facial nerve carries special sensations from the tongue. The name of the component is special visceral afferent. The name of nucleus is nucleus of tractus solitarius. Nucleus of tractus solitarius. And the facial nerve also carries sensations from the ear. So that is general somatic afferent, but it finally gives to the trigeminal nucleus. वो trigeminal nucleus को वो देते हैं, that is the spinal nucleus of trigeminal nerve. Spinal nucleus of trigeminal nerve. Okay, fine. Clear? So this is how you remember the components. बस क्या याद रखना है आपको? What is the nerve supply? अगर आपको nerve क्या supply करता है, you know. So automatically you, Hemant, we'll discuss this. Wait, Hemant. So you automatically get the components and उसके corresponding nucleus आ जाते हैं. Fine. So motor nucleus of facial nerve. We've seen the facial colliculus. तो वो diagram आपको draw करना है. And this superior sality and वो भी वहीं पे होते हैं in the pons. They are there. Fine. So you have to draw the diagram. And now you tell me where is the facial nerve attached to. Then you write its attachment to the brainstem. It is attached at the pontomedullary junction. Pontomedullary junction पे attachment है. फिर उसका intracranial course लिखना है आपको. Which foramen does the facial nerve enter? Internal acoustic meatus. The facial nerve enters the internal acoustic meatus. The facial nerve enters the ear, and the facial nerve undergoes a bend here. The facial nerve undergoes a bend. This is the promontory of the middle ear. That's the first genu of the facial nerve. The facial nerve goes above the promontory. That's the second genu of the facial nerve. And the facial nerve now gets out through the stylomastoid foramen, enters the parotid gland, and then gives 5 branches. फिर ये 5 branches देती है अपने. Okay. Which is the first branch of facial nerve here? That's a greater petrosal nerve. Second is nerve 2, stapedius. And तीसरा है chorda tympani. Chorda tympani. And then the facial nerve enters into the parotid and gives 5 branches. ठीक है? So this is in short, I've told you the course of the facial nerve. Now you tell me, अगर lesion यहाँ पे होता है, if the lesion is here first, what will the person complain of? Answer this. If the lesion is here at the stylomastoid foramen, the person gets a Bell's palsy. It's a lower motor neuron lesion of the facial nerve. The entire half of the face is paralyzed. That's Bell's palsy. Baki, chorda tympani supplies anterior 2/3. Sensations are intact. Nerve to stapedius supplies the stapedius muscle. So hearing is intact. Greater petrosal nerve supplies the glands. वो सब intact होगा. अगर lesion यहाँ पे है, lesion यहाँ पे है, so in addition to Bell's palsy, there'll be loss of taste sensations from the anterior 2/3 of the tongue. So ये clinical cases आएंगे आपको. हाँ, clinical presentation, clinical cases आएंगे. A person comes to the clinic complaining of paralysis of face. On examination, there is loss of sensations on the anterior 2/3 of the tongue, but hearing is intact. Hearing is intact. So where is the lesion? ठीक है, that you have to know. बाकी hearing is intact. Now you tell me, अगर lesion यहाँ पे है, number 3. So Bell's palsy होगा, loss of sensations on the anterior 2/3 of the tongue होगा, hyperacusis भी होगा because nerve to stapedius is gone. And if there's a lesion here, number 4, so there'll be a loss of secretions from all the glands except parotid. समझ में आ रहा है? There'll be a loss of secretions from all the glands except parotid. Clear है बच्चों? Can you identify the site of lesion now? हाँ, easy है, बस ये table याद रखना. And then where the lesions is, that is how you should be able to understand. Clear to all of you? ये clear है? कुछ doubts है इसमें? बाकी details you can fill in the blanks. Okay. Fine. Now we come to the glossopharyngeal nerve. Tell me, what is the glossopharyngeal? Another very important nerve is glossopharyngeal. Glossopharyngeal, facial and hypoglossal. 3 nerve अच्छे से करना. Glossopharyngeal nerve. Tell me, what is the glossopharyngeal nerve supply? The muscle of the 3rd pharyngeal arch. So name of the component, special visceral efferent. Glossopharyngeal nerve, special visceral efferent. The name of the nucleus, That's nucleus ambiguous. Nucleus ambiguous. 9th, 10th and 11th का common nucleus है. The glossopharyngeal nerve supplies the parotid gland, general visceral efferent. The name of the nucleus is inferior salivatory nucleus to supply the parotid gland. This supplies the stylopharynges. ठीक है. Glossopharyngeal nerve supplies the tongue, posterior 1/3. So special visceral afferent. Name of the nucleus is nucleus of tractus solitarius. Okay, and the glossopharyngeal nerve supplies the pharynx. So this is general visceral afferent. General visceral afferent. Again, उसका भी nucleus same है, nucleus of tractus solitarius. Nucleus of tractus solitarius carries sensations, दोनों sensations लेके जाते हैं. एक स्पेशल विसरल एफरेंट फ्रॉम द टंग एंड एक जनरल विसरा मतलब फैरिंग्स का वगैरह सेंसेशंस भी न्यूक्लियस ऑफ ट्रैक्टस सॉलिटेरियस के पास ही जाते हैं. सो न्यूक्लियस ऑफ ट्रैक्टस सॉलिटेरियस रिप्रेजेंट्स बोथ द कंपोनेंट्स. ठीक है, स्पेशल विसरल एंड जनरल विसरल एफरेंट. फाइन. सो दैट इज. नाउ टेल मी, where is the glossopharyngeal nerve attached to the brainstem? Answer this. Glossopharyngeal nerve का attachment बोलो brainstem को कहाँ पे है? Come on, students, come on, answer. So glossopharyngeal nerve is attached to the brainstem between what and what? Between what and what? Come on. Glossopharyngeal nerve is attached to the brainstem between the olives and the inferior cerebellar peduncle. Between the olives and the inferior cerebellar peduncle, the glossopharyngeal nerve is attached. The glossopharyngeal nerve goes to the jugular foramen, gets out through the jugular foramen. Okay, gets out through the jugular foramen, lies in the carotid sheath. फिर carotid sheath को pierce करके then it goes between the superior and the middle constrictor muscles of the pharynx. It goes between the superior and the middle constrictor muscles of the pharynx. फिर it enters the pharynx, it goes deep to the hyoglossus muscle and then supplies the tongue. फिर उसके branches आपको लिखना है. Tympanic branch of glossopharyngeal nerve forms the tympanic plexus, the nerve to stylopharyngeals, फिर tonsillar branch, the branch to the palate, वो सब branches आपको लिखने हैं. Same for the hypoglossal nerve. Hypoglossal nerve के nucleus बोल सकते हो. Hypoglossal nerve के nucleus, the general somatic afferent nucleus. That's the hypoglossal nucleus. Where is this hypoglossal nucleus located? In the medulla. Fourth ventricle and the close part of the medulla. पूरा hypoglossal nucleus होता है. Where is the hypoglossal nerve attached to the brainstem? Between the pyramids and the olives. The hypoglossal nerve gets out through the hypoglossal canal. Then it is lying in the carotid sheath. It comes outside the carotid sheath. It winds around the lower sternomastoid branch of occipital artery. Lower sternomastoid branch of occipital artery, and then it goes into the oral cavity. It lies on the hyoglossus muscle. Hyoglossus का वो diagram draw करना. It lies on the hyoglossus muscle and then it supplies the tongue. ठीक है, एक brief outline I have given you how to understand the nerves. How to understand the nerves. ठीक है, तो इतने nerves याद रखना. ठीक है बच्चों, एक मिनट, there was a slight confusion here. एक just let me clear this. See this is what I was telling you. ये था अपना internal capsule. So what is this? This is the caudate nucleus. This is the thalamus. That's a lentiform nucleus. ठीक है, lentiform nucleus. What is this capsule? That's the internal capsule. फिर आता है external capsule. And then comes this claustrum. ये claustrum था बच्चों. ये ना ऐसे था ना. Claustrum. This is claustrum. Then comes what? Then comes the extreme capsule. Extreme capsule. And then comes the insula. ये है insula. That's the insula. Okay. Yes, it supplies all the muscles of the tongue except palatoglossus. Clear, no? This doubt is clear, no? Insula is this part. That's a hidden part of the temporal lobe. That's the insula. हाँ. ठीक है अक्षत. External capsule, फिर claustrum, फिर extreme capsule, फिर insula. The same slide is kept for the sections, in the practicals. The same section is kept in the practical exams. ठीक है बच्चों, कुछ डाउट्स है तो पूछो. इतना important चीजें हैं for you. Just tell me one thing. Where does the medial lemniscus end? In which nucleus of thalamus does it end? The medial lemniscus and the spinal lemniscus ends in which nucleus of the thalamus? वैसे thalamus doesn't come as an LAQ, but MCQs आ सकते हैं. Yes, the medial lemniscus, the spinal lemniscus ends in which nucleus of thalamus? Ventroposterolateral nucleus of thalamus, right? Ventroposterior nucleus is divided into a ventroposterolateral and a ventroposteromedial. Ventroposterolateral में medial lemniscus जाता है and spinal lemniscus. Ventroposteromedial में solitary-thalamic tract, and there's one more, the trigeminothalamic tract. Solitary-thalamic tract is from the tongue, from the nucleus of tractus solitarius to the thalamus, and trigeminal is from the face. ठीक है, बस इतना कर लो बच्चों. देखो न्यूरो एनाटॉमी ना सिलेक्टेड क्वेश्चंस है, हाँ, उसमें सुपरल. एक मिनट, just answer this. A 70-year-old male patient presented to the emergency department with sudden onset of right-sided facial weakness with medial division of the right eye. Right side facial weakness with medial division of the right eye. On examination, he had a left-sided hemiparesis. MRI shows infarct in the paramedian branches. What do you think is this? Answer this. हाँ, समझ में आया? What is this? तो ऐसे आएगा MCQ. Right-sided facial weakness and medial division of the right eye. मतलब medial squint है, मतलब who's damaged the lateral. Weber's नहीं है बच्चे, ये Weber's नहीं है. This is Millard-Gubler syndrome. Medial division of right eye. Eye is deviated medially. मतलब who's paralyzed? Lateral rectus. Lateral rectus गया, मतलब which nerve is involved? Sixth nerve. तो सिक्स नर्व का इन्वॉल्वमेंट है प्लस फेस का इन्वॉल्वमेंट है. वेयर इज द न्यूक्लियस ऑफ सिक्स नर्व एंड द फेशियल नर्व का न्यूक्लियस लोकेटेड? दैट्स इन द पॉन्स. वो वैसे आपको एनालाइज करना है. सो दिस इज लीजन इन द पॉन्स. हाँ, कॉर्टिकोस्पाइनल ट्रैक्ट्स. यस, समझ में आया? ये मीडियल मेडलरी नहीं है ये बच्चे. दिस इज मिलार्ड गुबलर सिंड्रोम. मीडियल मेडलरी में टंग इन्वॉल्वमेंट है. टंग इन्वॉल्वमेंट है ना बच्चे. मीडियल मेडलरी में टंग इन्वॉल्वमेंट है, फेस का इन्वॉल्वमेंट नहीं था. हाँ, दिस इज मिलार्ड गुबलर सिंड्रोम. कैसे इसको एनालाइज करोगे? फेस का वीकनेस है, मतलब फेशियल नर्व का न्यूक्लियस इज गॉन. हाँ, मोटर न्यूक्लियस ऑफ फेशियल नर्व गया. मीडियल डिविजन ऑफ राइट आई, मतलब लैटरल रेक्टस पैरालाइज हो गया, तब आई इज डिविएटेड मीडियली. Fine, matlab which nucleus is gone? Sixth nerve ka nucleus. That's how you analyze it. Fine, so that's Millard-Gubler syndrome. Name the site of lesion. It's the lower half of pons. What is your diagnosis? That is it. So you have to draw the diagram. Thrombosis of basilar artery. Fine, no? Okay, that is how it is. And bas ye hai LAQs and ye hai SAQs. This is what you are supposed to study. Corpus callosum आएंगे तो उसके parts आपको लिखना है. And the fibers which emerge from the corpus callosum, the forceps minor, forceps major and the tapetum, वो आपको लिखना है. फिर anterior cerebral artery है callosal sulcus में. That is what you have to write. And the corpus callosum के नीचे fornix है and the septum pellucidum. ओके बच्चों, सी इफ एनीथिंग कम्स आउट ऑफ द बॉक्स यू शुड बी एबल टू थिंक. एक दो सवाल ऐसे होंगे विच आर गोइंग टू बी डिफिकल्ट, विच आर गोइंग टू बी आउट ऑफ बॉक्स. ठीक है. गुड शिवम, पढ़ो अच्छे से एंड देन कम इनटू एम्स ऋषिकेश. Fine. So just read all these things. Tears of brains with syndromes, peduncles, and LAQs तीन चार ही है. Only 3-4 LAQs are there in the neuroanatomy. मेन क्लिनिकल सवाल आ सकते हैं न्यूरोएनाटॉमी से, क्लिनिकल्स आते हैं. फाइन. सो LAQ से क्या आएगा पता है? LAQ विल बी हेड एंड नेक. हेड एंड नेक या अपर लिम का LAQ आ सकता है बिकॉज न्यूरोएनाटॉमी इज मेनली फॉर क्लिनिकल टाइप ऑफ क्वेश्चंस. बेसल गैंग्लिया इज नॉट दैट इंपॉर्टेंट. नहीं, बेसल गैंग्लिया इतना इंपॉर्टेंट नहीं है. दैट इज मेनली फिजियोलॉजी. फिजियोलॉजी का टॉपिक है. दैट इज मेनली फिजियोलॉजी. वी डोंट गेट क्वेश्चंस फॉर एनाटॉमी, बट उसके पार्ट्स वगैरह याद रखना. कॉर्डिक न्यूक्लियस एंड putamen that forms the striatum, the globus pallidus, substantia nigra, and the subthalamic nucleus that forms the basal ganglia. ठीक है. ब्रेनस्टेम बच्चे, ब्रेनस्टेम डजंट कम एज एन LAQ, बट सेक्शंस आते हैं ना ब्रेनस्टेम के. ब्रेनस्टेम के सेक्शंस आते हैं. एब्डोमेन का LAQ बोला है मैंने, एब्डोमेन के लेक्चर में देख लो. आई हैव टोल्ड ऑल दिस थिंग. Anatomy is over. Now one practical lecture I'll take on Tuesday. Tuesday को एक practical session लेंगे जिसमें I'll show you the slides. Slides देखते हैं अपन. How to identify the slides वो देखते हैं. Some important slides. Histology slides रखूंगा. And embryo के जो models है ना, some important models of embryology will keep and we'll have a discussion. बच्चों, see, embryo models is a 10 mark question. हाँ, embryo and histo will see on Tuesday. हाँ, Tuesday को देखेंगे. Embryo models is a 10 mark का table, and if your theory is perfect, you will be able to answer the embryo का table. Fine. Histology में important identifying points and one good diagram you draw, that's enough. Fine है बच्चों. So that we'll see on Tuesday. मंगलवार को देखेंगे. Tuesday we'll see histology slides and embryo का. ठीक है. And some X-rays I'll show you. X-rays which are kept in the practical. So that is practical FARRE. One lecture for practicals FARRE. ठीक है. On Tuesday. किसी को कुछ डाउट्स है तो बोलो. एनीवन हैज एनी डाउट्स? थैंक यू क्रिश. गुड. हाँ, दिस वाज अ क्विक रिवीजन. सी बच्चों, ये ना, दिस इज अ क्विक गो थ्रू द टॉपिक्स. नाउ यू हैव रेड एवरीथिंग, यू हैव अंडरस्टूड थिंग्स, सो दिस इज अ क्विक गो थ्रू. हाँ, इट्स डिफिकल्ट टू टीच एवरीथिंग. हाँ, एक पूरा महीने का टॉपिक्स है ना, सो दिस इज अ क्विक रिवीजन. फाइन, थैंक यू. ऑस्टियोलॉजी देखता हूँ जितना कवर हो सकता है. There's a hard part made easy series of PW. Hard part made easy series एक है YouTube पे. उसमें I've given all important things which are to be told in the exams. Hard parts made easy series. PW के channel पे है वो. You can see that also. Just the important things which are asked in the MCQs. In the bones have told. Notes revise करो बच्चों. Notes revise करो. Important questions तो आपको पता है. Just revise the notes. ट्रैक्स वगैरह नहीं आते बच्चे. ट्रैक्स वगैरह नहीं आते हैं. नहीं आते. दैट इज ओनली फॉर योर अंडरस्टैंडिंग. वो बस समझने के लिए. ठीक है. फाइन. ओके. सो थैंक यू ऑल ऑफ यू एंड ऑल द बेस्ट. All the very best from the entire team of PW Meded. You have been studying very hard and be fresh for the exams. You'll be definitely able to answer everything and give good results. ठीक है. Thank you. Bye bye. किसी को कुछ डाउट्स है तो बोलो. Thank you.